Hi, my name is Emma. This is a project for my neuroscience class. So if you know me in real life, keep scrolling. For this project, I chose to research hypermobile Ehlers-Danlos syndrome, also known as hEDS, which is a genetic connective tissue disorder that occurs in about 1 in 10,000 people and is caused by genetic mutations to the genes that either affect collagen structure directly or the implementation of collagen throughout the body. Ehlers-Danlos syndrome, as a connective tissue disorder, affects everything in the body containing collagen, just like skin, your joints, your muscles, your organs, your blood vessels, just kind of everything. Diagnostically, it is characterized by generalized joint hypermobility, so it's hypermobility in most joints in the body, hyperelastic skin, recurrent joint dislocations, and systemic connective tissue disorder signs. While it's not part of the diagnostic criteria itself, it is very, very common with this type of EDS to have neurological issues such as autonomic dysfunction and also proprioceptive dysfunction, which is the topic of this poster. Pathologically, again, the exact molecular basis of HEDS is not known like the other 12 types of EDS, but we do know it occurs in an autosomal dominant inheritance pattern, and it causes visible changes to collagen, fibroblast structure, and extracellular matrix organization. HEDS causes weak and loose and elastic collagen, which is what causes that systemic ligamentous laxity and stretchy skin. So, in normal people, proprioception informs your body where it is in space and also helps you prevent injuries. There are organs in your muscles and your tendons called muscle spindles and Golgi organ tendons, which sense changes in stretch and collagen fibers, which is going to be important later. So when you extend a joint, your muscles and your tendons respond to that stretch in the collagen fiber and the change in stretch specifically, which will physically pry open ion channels and send action potentials to your spinal cord, which does two things. It sends information right back to the muscle to prevent injury in the moment, but also sends information to the brain to inform future behavioral actions to decrease the chances of injury in the future, which you want to happen. But in hypermobile EDS, proprioception generally is not as good as the regular population because people with EDS have stretchier collagen to begin with. There's not as big of a change in the actual collagen fibrils when you stretch a joint. So because there's not a change in collagen stretch because it's already stretched out, you're not going to get that same information to your spinal cord and back to the joints, but also to the brain. So you're going to get less frequent and less reliable and less accurate information from your proprioceptors. So this leads to decreased awareness of the natural proprioception that people, the natural hyperextension, sorry, that people with EDS already have, but also your brain is not going to get that information that you're hyperextending the joints, and it's not going to tell you to do that differently in the future. So you're going to keep hyperextending these joints, which will cause further stretching of those collagen fibers, which will cause further decreased proprioception. It's a bad cycle to get into, which is why it's so important to do things with HEDS in treatment that increase the patient's awareness of where they are in space in their joints and will decrease hyperextension to decrease the chance of injury in the future. A fun little fun fact about HEDS. People, like doctors that treat it and PTs and everything, usually will do a test, same test that they do people with strokes, where you will hold out a limb and close their eyes and ask them to meet where it is in space, just to see how well your proprioceptors are working. But people with HEDS tend to perform significantly worse than people without it. So you try it at home if you want. Like stick out your arm and close your eyes and try and match it. Hopefully you're better at it than I am. I hope you learned something new. I'm gonna get out of the way so you can see my poster. It's for you, Dr. Mooney. I hope you loved it. Also, you can check the description because in the rubric, I have to put a description that tells you much, much more. So, hope you learned something new.